The Reimagining Communities initiative addressed environmental health disparities across 9 counties. The project targeted communities of color and underserved rural areas disproportionately burdened by flooding, extreme heat, poor air quality, mold, and failing infrastructure, combining expert presentations with resident listening sessions.
This project is important to the Northeast Ohio Black Health Coalition because one of the things that we do know is about environment. So when we talk about these environmental determinants of health, we have to talk about all of the things that impact the communities in which people live. They live, work, learn, and play. And so when we talk about those social, those structural, and behavioral determinants of health, we cannot overlook the environmental factors.
Here's what residents across Northeast Ohio had to say about the listening sessions.
What we learned here today was how our environment impacts the health of our community and our families, and it also has a lot to do with social determinants of health as well.
Today I learned about having myself prepared. I didn't think that far ahead for just in case anything happens in regards to flooding or anything. So I got a chance to learn. They told me to go to FEMA.com and I get a chance to see what I need to do in regards to having myself prepared with paperwork.
I was amazed by this opportunity to get together, to hear from different parts of Geauga County in terms of where the vulnerabilities, as well as where the opportunities, the places that could become resilient centers.
I was so glad to be a part of what Yovanka is doing here today. The information was very informative. The strategies that we came together to discuss, I believe, will make a profound difference in what we can do together.
I love the event today. I love that it was held here in a predominantly Black community. These are the places where the disparity has happened: lack of tree coverage, flooding, and lack of resources.
Today was a very helpful event because it brings community members together to look at some of our ongoing personal experiences regarding climate change and how we need to be proactive in moving towards the future to preserve our health and communities.
I think that there was a lot of really good groundwork that was laid down by the program that we had today and the speakers that we had. And it seemed like the information and feedback that was given was really taken into account and will actually turn into some really good change for our community.
I love the statement for where we play, where we worship, and where we work. And so I think that when we come together as community members in all of those spaces to think about how we look at flooding areas in our communities, in our neighborhoods, how we look at where we need more trees, how we look at where the areas are for our children to play is very impactful. So I'm grateful to these organizations for the information that they brought to our community today.
And we're continuing the work, digging deeper, lifting higher, and building a better environment, one community at a time. Same mission, new name.
Good morning. Welcome to the 11th Annual State of Environmental Disparities in the African American Community. This is our 11th conference. I am the Executive Director of the nationally recognized Northeast Ohio Community Resilience Center. We were formerly the Northeast Ohio Black Health Coalition. And so for us, I want to thank my incredible team, first off, for doing a wonderful job of putting this together for us today. I want to thank our contractors, our consultants, and most of all, I want to thank our board of directors and our volunteers, because without them, we could not do any of this. But I also want you all to say a prayer for our friend and for the Assistant Executive Director, Dr. Michelle Pugh. Dr. Michelle is currently in the hospital, and we want to make sure that we send out love and healing her way. And so for me, I want to start off with a little story because my team knows about me and this storytelling. So 32 years ago, when I started this work, I would go before audiences and say, this is the first generation that will not live as long as their parents. And what I did not realize then was that it was my generation. That Generation X is the first generation that will not live as long as Boomer 1, Boomer 2, and the silent generations that came before us. My grandmother lived to be 92 years old. My uncle is now 80 years old. And I look at this and say our life expectancy has steadily dropped. For African Americans, when we look at our life expectancy, we have lost some 5 years in the last 10. So our life expectancy has dropped from 75 years to 70 years. And that means that the millennials, Gen Zs, the alpha generation, that their life expectancy is expected to be lower than ours. That is unacceptable. That is why we want to make sure that we are talking about the issues that are disproportionately impacting our communities. That is why it's important for us to talk about our social, our structural, our environmental, and our behavioral determinants of health and how they impact our community. We have to do everything that we can to extend the life expectancy of our community and make sure that our community has the knowledge that they need in order for them to live longer, happier, and healthier lives. Who knew that 15 years would go by so quickly? I never thought in a million years that life would lead to transformational work. From lead poisoning to air quality work across the United States, the Northeast Ohio Black Health Coalition, which is now the Northeast Ohio Community Resilience Center, focuses its work on air quality and environmental justice, primarily in the regional and national levels to combat racial and structural health disparities. While rooted in Northeast Ohio, our advocacy extends nationally through our federal policy engagement and legal coalitions addressing particulate matter. We must never forget that the advocacy and the policy work of the federal suit standards, that we partner nationally with groups like Earth Justice and the American Lung Association and Sierra Club to defend and push for stricter national ambient air quality standards to protect Black communities disproportionately burdened by industrial pollution. We lobbied federal environmental leadership and the US EPA to prioritize cumulative health impacts over industrial interests when reviewing and approving emissions permits. Our regional and community level air quality initiatives have included our community conversations, which we conduct these public engagement tours and forums in cities all over Northeast Ohio. These engagement tours are designed to educate residents around asthma triggers, localized pollution, and climate resilience. For us, looking at how the work of distributing air purifiers to thousands of residents in Northeast Ohio, particularly to low-income families, seniors, and children dealing with chronic respiratory conditions following poor regional quality ratings, air quality ratings. We have collaborated with local groups to pressure municipal governments for stricter local air pollution codes. As you know, in Northeast Ohio, most of our air quality codes have not been updated since 1977. That is absolutely unacceptable. For those of you who know me, you know that in 1977, I was 10 years old. I am almost 60 years old. I'm a grandmother. And so we know that the polluters have changed, that the particulates have changed. So the policies also have to change. We have also spearheaded community conversations tied to the Department of Justice, our Community Corrective Action Plan. This initiative for us linked the community voices with policing reforms and addressing racial disparities. For us, this work included identifying root factors of problematic law enforcement practices and connecting community vision with fair, equitable treatment under the law. Many solutions and discussions from these local sessions aligned with systemic changes found in our current consent decree for the city of Cleveland. So you can know that a large percentage of that consent decree came from the work of the Northeast Ohio Community Resilience Center. For us, establishing equitable and actionable strategies reflecting fair law enforcement practices, gathering direct feedback from disproportionately affected communities around institutional and racial disparities was important, bridging the gaps between law enforcement, public health, and marginalized neighborhoods. For us, our work has also included maternal and infant mortality through community-driven collaboratives focused on racial disparities, doula access, clinical initiatives. We spearheaded critical research with Kent State University regarding pregnancy and infant loss. We made the connection between maternal and infant mortality and lead poisoning long before the mainstream voices here in the city talked about it. We actively linked systemic racism to severe health disparities, demanding systemic policy changes in housing, education, and criminal justice to save Black lives, emphasizing factors like the lack of affordable housing, poor environments, and environmental gaps directly dictate life and death. Our work on public policy changes, demanding legislative and institutional shifts rather than superficial fixes to correct generational health gaps, has put us at odds with the local elected officials. Over the years, we have been partnering alongside broader regional initiatives. After Cleveland and Cuyahoga County officially declared racism as a public health crisis, for us, we looked at that public health crisis as the ground working alongside our local efforts, public and private partnerships to push for data transparency, cultural competency, hospital care, and equitable community investment. We have been the leading force in advocating for a total ban on menthol and flavored products throughout Northeast Ohio, framing the issue as a critical matter of racial justice and public health equity. For us, we look at the Black community and menthol marketing leading to severe health disparities and preventable deaths. In Cleveland, where adult smoking rates are roughly 35%, triple the national average. Nearly 85% of Black smokers use menthol products. In partnership with the American Heart Association, the Cleveland Department of Public Health, and over 40 other community organizations, we formed the Campaign to End Tobacco Targeting. This initiative directly lobbies local lawmakers to end the sale of flavored e-cigarettes and mentholated tobacco products. After years of stalling and pushback from business owners, Cleveland City Council successfully passed a comprehensive package of 4 tobacco laws in 2025. These laws significantly increased retail oversight, enforced age verification, and laid the groundwork for capping local tobacco retail licenses. The Northeast Ohio Black Health Coalition has expressed our deep discontent with the passage of TRL and not the no menthol legislation that we lobbied for in the first place. As a coalition, we have continually engaged faith leaders, civic organizations, and local poets to pressure city council members, emphasizing that combating the menthol epidemic is central to addressing Cleveland's declaration of racism as a public health crisis. To counter the cooling and aesthetic effect of menthol, which makes it easier for youth to start smoking and harder for adults to quit, we launched the widespread "You Have Been Targeted" billboard campaign. The initiative for us deployed educational messaging across major African American neighborhoods in Northeast Ohio to expose predatory tobacco marketing tactics. The primary challenge for the Northeast Ohio Black Health Coalition and our partners remains the state-level preemptive battle. So for us, we have also did work on linking oral health to chronic disease, emphasizing how poor dental health correlates directly to higher rates of cardiovascular disease, diabetes, and adverse pregnancy outcomes in the Black community. Our lead poisoning advocacy and collaboration with the groups that we have co-founded, the Cleveland Lead Advocates for Safe Housing, their fight for childhood lead exposure, lead poisoning in children causes developmental delays and is linked to weakened tooth enamel and increased risk for severe dental cavities. The coalition, we support broader legislation and structural initiatives aimed at resolving the state's dental health professional shortage areas. We are definitely short of dental providers and medical providers in the African American community and in our neighborhoods we serve. For us, this includes advocating for the integration of mid-level dental providers and supporting the mission of new community-centric training grounds like the Northeast Ohio Medical University College of Dentistry to build a more diverse and culturally competent local dental workforce. For us, we also serve on the board of directors of the Ohio Oral Health Ohio, currently as the board chair. The Northeast Ohio Community Resilience Center also looks at addressing adverse childhood experiences by focusing on social, structural, and environmental determinants of health, community advocacy, and targeted educational forums. Our approach centers on the deep connections between historical inequities, environmental hazards, and trauma in the African American community. Linking toxic exposure such as high rates of lead poisoning in Cleveland, housing and schools, to cognitive behavior and developmental stress in children, conducting educational initiatives, workshops, and advocacy trainings to help neighborhoods recognize and respond to systemic barriers. For us, this includes collaborating with regional groups and health advocates to address systemic disadvantages in housing, education, and health equity that drive childhood trauma rates. For us, we have also looked at how we tackle climate change in our reimagining community conversations and looking at this direct material aid. We are the first African American organization in the country to receive and secure a $1.3 million grant from the National Oceanic and Atmospheric Administration to build coastal and extreme weather resilience in Northeast Ohio. Our Resilience Hub, which is looking at establishing a network of 30 or more community-based organizations across high poverty, climate vulnerable areas in Northeast Ohio. Hosting public forums across counties like Cuyahoga, Ashtabula, Lake, Mahoning, Medina, Trumbull to evaluate resident preparedness for extreme heat, flooding, and severe storms. We know that the African American community is resilient, but we know that the African American community is not prepared. So for us, looking at what is going on in Black and Brown low-income neighborhoods and connecting high-rate asthma rates and respiratory illnesses among minority children and seniors to local industrial pollution, the lack of a tree canopy, and climate-worsened air. For us, the Northeast Ohio Regional Community Resilience Center has played an essential multi-front role in protecting Black communities in Greater Cleveland from the disproportionate impact of also COVID. And that leads me to where we are today. Right now, we are in a summer uptick of COVID. Our numbers have climbed relatively high over these last few weeks. We also are looking at West Nile virus again in this landscape. We know what happened in 2003 with West Nile. I, for one, lost a family member that I deeply loved, the West Nile virus. And so for us, it is important to make sure that our community gets the right information. It is important that you hear from our speakers today. I thank Dr. Zachary Williams, who has led this effort as our African American Policy Director and our Social Determinants of Health Director. So looking at the way that we are coordinating our voices across this country to make sure that the plight of our communities are understood from a professional level and from a community level. I'm going to turn it over to Dr. Williams, who will lead us through our day as our host for our 11th annual State of Environmental Disparities in the African American Community. Thank you so much.
Thank you, Ivanka. I want to thank you for your great leadership, and also want to thank our entire team who's helped to make our conference possible. Carrington Jones has been incredible, and Dr. Michelle Pugh and Samaria Ford and Zena Hempstead, Erica Jarvis, our entire team want to thank you for helping to make this possible, because it could not be possible without you. I want to thank all of our participants and Just to let you know, our summer virtual conference, our 11th annual summer virtual conference, explores the state of environmental protections in the African American community through historical analysis, policy examination, and lived experience. Our conference goals and learning objectives are to illuminate the historical and contemporary environmental injustices impacting the African American community, tracing the evolution of historical protections from early civil rights struggles to present-day policy landscapes. Examine how local, state, and national environmental policies, regulatory failures, and community-driven interventions shape health, safety, and ecological well-being in African American neighborhoods, with attention to structural racism, disinvestment, and environmental neglect, and to equip attendees with actionable plans and opportunities and strategies to advocate for equitable environmental protection, strengthen community resilience, and influence policy reforms that promote environmental justice and long-term sustainability in African American communities. And to begin with, we will have Dr. David Padgett, who will be our first presenter. Dr. David Padgett is an associate professor of geography and founder and director of the Geographic Information Sciences Laboratory at Tennessee State University, TSU, in Nashville, Tennessee. For over 30 years, Dr. Padgett has provided GIS-based technical assistance to hundreds of environmental justice and community-based organizations. In April 2019, Dr. Padgett was awarded the American Association of Geographers Presidential Achievement Award for significant contributions in advancing geography, GIS, and STEM education within the historically Black college and university system. In September 2019, Dr. Padgett was named an Ethical GEO Fellow by the American Geographical Society in support of its project Democratizing Geospatial Technology, a model for providing technical assistance in community-based participatory mapping to environmental justice stakeholder communities. And since June 2022, Dr. Padgett has been the team lead for the HBCU Environmental Justice Technical Collaborative, HEJTC. And the HEJTC has developed two GIS-based tools, the HBCU Justice 40 Funds Tracking Tool and the HBCU Climate and Environmental Justice Screening Tool. And the title of Dr. David Padgett's justice presentation today will be on the subject of water justice, and he will lead us in a water justice workshop. Again, we want to thank everyone who has been with us today, and we look forward to your participation, your questions, and we want to thank our partners and CEU participant partners, Jacqueline Delata. I want to thank Danielle Smith and also Dominique Essie and others for helping to make this conference possible. Thank you so very much. Yeah. everyone, we're about to start soon. Dr. Paget will be with us. Before we do, let me share with you some of Dr. Paget's workshop objectives. And just to let you know, Dr. Paget has included in the chat, for those of you who are able to see it, a water justice workshop fact sheet. And so you can access that as material, resource material that you can use and take with you. And also just to let everyone know too, for those of you who are getting CEU credit or CME credit or CLE credit, we are encouraging you to stay with us for the entirety of our program. We will provide information at the very end about how to access that information. Dr. Paget's workshop objectives include number one, where workshop participants will be exposed to the basic physical processes associated with urban and coastal flood hazards. Two, workshop participants will augment their knowledge base and vocabulary of terms and issues associated with urban and coastal flood hazards. Number three, third objective is workshop participants will use open source mapping tools to assess the risks of flood hazards in their communities. And number four, workshop participants will build an attributable data table for an ArcGIS online map, and then create a data visualization of their local flood hazards using ArcGIS online and other mapping tools. And just to share with you as well, Dr. Paget's research and even some of our other participants will speak to one of the major issues that is on the minds of a lot of citizens in Cuyahoga County and Cleveland, Ohio, state of Ohio, and across the country, that of data centers, and how data centers environmentally are impacting and influencing in a very hazard-filled and problematic way communities, both rural and inner city. And so as it relates to water justice, environmental justice, there is an interrelationship between all of those issues and some of what you will hear today, including in Dr. Paget's presentation. And so we thank you for your presence. Thank you for your patience. Ask that if you have any questions when it comes time for the question and answer period, to please, put those in the chat. And we look forward to your participation and are excited that you're joining with us today. Enjoy your day and enjoy our conference. Thank you.